at it all. Mummy might ring up, say, oh my God, you know, little one has taken all the medicine, what shall I do there? Say, don't worry. If the body needed something from that itself, it would take it. If not, nothing, no harm. That's how safe it is. And it's having that confidence that it is very safe. Can you move forth with it and help as many people as you can? Because, you know, it will either touch. So if it was wrongly diagnosed or wrongly interpreted, then they may not feel that much better. The next time, we'll check it again. Give me information again.
So you produce your own medicine and herbs independently? We
bring the medicines from the UK, from the homeopathic pharmacies from the UK.
Pharmacies in the UK.
We go to them, we approach them, because we don't have big sponsors behind us. We are all self-funded. It's a small team. We go to the homeopathic pharmacies and we ask them that we are going to Gambia and Africa. Can you help us? And Ainsworth is one of the UK pharmacies, and they say, okay, and then we'll give them some of the top 50 remedies which we feel we use most in the Gambia, and they will donate it to us. So they'll donate to us all the liquids, which then we've been bringing over. Inshallah, in the clinic in Mandua, then we will start stocking up the medicine.
Let's say, let me ask this personal question. Probably I got a cut on my leg or broken leg. I come to you, what will be your role in that? You'll not be dealing with it medically.
No, okay. So, for example, you've got a cut on your leg and it's still raw, or it's still, you know, it's bleeding. We have remedies. For example, there's a remedy called Hypercal, which is made from herbs, which helps heal wounds very quickly. So, if it was bleeding, you would clean it, bandage it. So, you need to clean. So, first aid is important. So, you need to be able to clean the wound, check the wound, and if it doesn't need any stitches or anything, then we spray some Hypercal liquid. We give internal medicines, and we've seen from experience how quickly a wound can get healed. I mean, in the Gambia, mashallah, because sometimes we've gone in the North Bank. I've been to a Dara in the North Bank with a lot of the boys. Just a few years ago, a lot of the boys had a lot of leg wounds, and from the sticks, and we saw so many leg wounds there. So we treated all the leg wounds, and I left, I think Amadou, he was the guy there, this spray, and I said to him, when you see the boys with wounds, use this. I teach him how to clean and use wounds. When I came back, he said, that stuff you left, he said, it was very good. He said, when it finished, they thought I was hiding it. They went and emptied his house out, his compound out, looking for it. They thought he was hiding it for himself. And he said it's like gold dust. It healed wounds so quickly, he didn't need to take any further. So that was wounds, you know, and I can give you many examples, mashallah. In one village, like I said earlier, one woman had a leg infection, continuous. And for years, it comes and it goes, it comes and it goes, but it just wouldn't totally clear. So we gave her some of the same Hypercal tincture and some medicines to take internally, because internal healing...
The tablets?
The small tablets, yes. The internal
made of natural
healing,
herb.
made of natural herbs. The tablets are blank. When you put the drops on there, they become the individual remedies. So they will all look the same. So you have the tablets here, they look the same. What is the difference? They've been medicated differently. Yeah? So when you said with the homeopathic pharmacy, the drops I explained to you earlier, the drops are put in and they get absorbed into the tablet. And so they're different. Yeah, but they look the same. So with this, I was saying the internal healing is as important as the external healing. So you're applying externally, but you're giving them tablets internally for the body to heal from inside. Because sometimes wound can heal from the outside. Because the inside is not healing, that's why it keeps on coming back. So the internal healing is as important as the external healing. So with this woman in one of the villages, we gave her external, but we also gave her internal. When we saw her 6 months later, her leg, they called her especially to show us that it was totally clean, and it has never come back since. And yet they said they have seen this woman time to time, year after year, with the same infection. And now it's gone, and it's gone for good, alhamdulillah.
For example, somebody with complex medical condition, probably needing surgery, had done surgery. You may not be doing surgery as a per se. But then what do you do? Post-surgery counseling and therapy and...
Yes, yes. So, I mean, even in the UK, there are many surgeons and doctors that will use homeopathy medicines as well. So, for example, you know, you need a surgery, and say, right, you need to go to the hospital, and that needs to be fixed, so you need to have surgery. So we'll give medicines pre-surgery and post-surgery, which helps the healing process much quicker. So if you had a broken bone, there's a remedy called Symphytum, which helps the bone heal much quicker than if you had nothing. There's a lot of research which people have researched with people who, say for example post-surgery, they have been on homeopathic remedies and not been on homeopathic remedies, and they measure how quickly the healing process is taking place, and because of the remedies. And this is why a lot of surgeons will use homeopathic remedies, especially post-surgery, to help the healing process. So we will have our patients come to us, say, I'm due for so-and-so operation, can you help me with the healing process? Say yes. So we give them remedies according to what kind of operation she's having or he is having. And they will report back to you, oh, I went to see my consultant and he was surprised to see how quickly my bone healed or my wound healed or whichever the condition was healed. And we hear that time and time again.
What is your relationship with the conventional medicine and probably traditional, if you're in Africa, of course, and herbal, all these things?
Generally, internationally, it's very good. There are some conventional who will say, oh, you know, just do conventional or don't do homeopathy. Ideally, I believe we can all work together and help humanity generally. So we do have a lot of conventional doctors who do use homeopathy as well in the UK, and there are some who do not believe and do not use. It's personal choice.
Would a conventional doctor refer a patient to
if he or she,
a homeopath?
Yes, if he or she believes that.
That's a kind of working relationship.
It can be, yes. There has been. They're both kinds. So there's a whole faculty in the UK which have doctors, surgeons, nurses on board as members who use homeopathy as well. So they refer, and they can either use it themselves or they'll refer. In some surgeries, some GPs in the UK, I've approached a lot of GPs where they will say, okay, this person is depressed, I know she needs a bit more help. Why don't you go and see the homeopath as well? And so the relationship is good. It all depends. Like I said, some will and some won't. It's the same everywhere. But overall, yeah, it's good. And this is what we intend to do in the Gambia, inshallah, working with the Minister of Health, working with the government, is to create a total holistic hospital where we have surgeons, conventional medicine where need to be used, where you can avoid using, and working together.
So you've been in the Gambia for how long now?
5 years now.
5 years?
5 years, and this is my 11th trip.
11th trip?
Yeah, I'm half Gambian now.
And do you kind of plan to put up any kind of, would I call it hospital? Would that be the appropriate name?
Well,
or some
we
kind
already
of
have
facility for?
Yes, we are ready. It's on completion. We have a centre in Mandwa, in Brikama, just past Brikama. It's Mandwa Centre of Integrated Medicine. The reason I said integrated medicine, so it's integrating everything together.
Together.
Now that, inshallah, the vision is, that will be like a hub, not just of Gambia, but the whole of Africa. We want to bring in training, and we have the university from the UK involved with the University of Banjul, and they are starting talks and MOU together, inshallah. And it's not just us coming out, but it's training, self-sustaining the people of Gambia. So training will take place from Mandwa. But Mandwa is one centre. Inshallah, with that will be a model which then can be taken anywhere in the Gambia. Once the degree training is set up via the universities, the two universities talking, there will be people coming from all over Africa to train in this method, gaining a degree from the Gambian university and then taking it back to their country. The vision, inshallah, is to get everybody connected. So, in the long term, come back to your question, yes, there's no reason why not that a hospital will work together with homeopathy, with surgeons, and doctors, conventional doctors.
Training and research in particular will be very much important in this area.
Definitely.
The more you do this thing, the more you come across new problems, more complicated problems. You need to have good knowledge of herbs and trees and all those things.
The training is really important. So that's why initially training will be started with people already trained at medical, like nurses, midwives. Initial basic training on homeopathic medicine will begin with these people. And then by the time the degree and the diploma is in place, they're already part trained on basic first aid. So it's small steps first.
In the communities that you're operating in the Gambia, what have been the most common problems?
A lot of common problems, I would say, would be back problems, skin